afternoon, everybody. My name is Colonel Retired Lenny Enzel. I am a proud member of the Army Nurse Corps Association, been that one for a long time, and former board member. And I am just very delighted that I was asked to moderate this very interesting session. If you were around the Army Nurse Corps the years I was around, then you definitely had heard the name Colonel Diane Corcoran. Very prestigious position she held in the Army Nurse Corps. Before I introduce her, I'm going to go over just how we're going to run this. We are not using the chat and we are not using the raise hand. So when you have questions, please put them in the Q&A. And if you're not familiar with using this modality, down on the bottom, you'll see the number of participants. If you want to look at who's attending, you can see which of your friends are there. Do not touch the green button that says share screen because Diane's going to have her presentation there. And then go to the Q&A and I will be watching. And when Diane's done with her presentation, then we will go into the Q&A session. We expect this presentation to last about an hour. We'll do about 45 minutes of Diane presenting. We'll do 15 minutes of questions. And then as you want to drop off at the end of the hour, Diane is willing to stay on and answer any questions or have any discussions with you. We're going to have a few polling questions that we'd like you to answer in the beginning, just talking about this topic and what your experience with near-death experience has been. We are recording it, and it will be posted on the Army Nurse Corps Association website, and it will be available to the members of the association. Diane has also very generously agreed to share her slides with you. So if you want the slides, I'm sure she'll give you her contact information at the end, or you can put it in the Q&A. Or contact ANCA afterwards and we'll get with Diane and get a copy of the slides to you. So I think that's all of the kind of ground rules and information. So I'll go right into introducing Diane because she has just a ton of great information for us. So it's actually Dr. Diane Corcoran. She's got her PhD. She spent 25 years in the Army Nurse Corps. And she has all sorts of awards and recognitions that she received there. I was looking at her CV this morning, Anita Newcomb McGee, all kinds of awards. And she also was the first Army nurse to command a hospital, the 86 CASH. So we're very proud of that. And she's been a nurse for about 50 years. And she's been researching and lecturing internationally on near-death experiences for over 40 years. She's published, and I'm sure she'll tell you something about that, or you can Google her. She's been the president of the International Association for Near-Death Studies, and she has a website that you can also find by Googling her. So I don't want to take up any more of the time. I will close off my camera and my microphone and I will monitor the questions and I will turn it over to Diane.
It's very nice to be here. I'm very excited to be able to do this for the Nurse Corps. I want to say, for those who don't know, this started over 50 years ago. I was in Vietnam. I worked pre-op and recovery and had a young man come to me and in the middle of the night and said, I need to tell you something, but you have to promise to believe me. So I told him I would, and he proceeded as he was crying and tears rolling down his face to tell me what I now know to be a near-death experience. At the time, it was 1969, I had no idea what he was talking about. I only knew that I had to say something positive and reassuring because he was so upset. And so that has led me on this journey for 50 years of lecturing and teaching and trying to get the services and the VA to pay attention to these service members. because they are suffering tremendously from not having support or not having somebody to listen to them. So I'm going to have to do this very quickly because we only have a short period of time. So I'm going to give you the essence of what an NDE is, what the characteristics are, what the after effects are, and some clues just about how you support it. And let you know that I am always available to help, to lecture, to do a Zoom in a hospital, or anything you need. Okay. The definition, characteristics, after effects, and guidelines. You can see the near-death experiences when somebody has a clinical crisis, an accident, traumatic event, and goes on to experience one or more of the 15 characteristics that are universal. It doesn't matter if you're in Israel, in Thailand, where you are, these characteristics are universal. A near-death experience that happens in combat, we call a combat near-death experience. And this can happen in many different ways: training accidents, explosions, being shot. Who has them? Everybody. All ages, all genders, all cultures, religion or lack of religion. We have atheists who have them. They usually don't remain an atheist, but all socioeconomic groups. The circumstances we hear most often are combat, extreme trauma like an accident, an MI, heart attack. Near drownings are what most children have. Unfortunately, I don't have the time today to talk about children. Their after effects are a little different, but it's so important to listen to them. Most children have NDEs during near drownings. Electrocutions, all kinds of trauma, accidents, allergic reactions, long-time illnesses, cancer, any kind of terminal illness, extreme surgery, distress, surgery, pregnancy, training accidents. So these are the characteristics. People talk about watching their body from the ceiling, being separate from their physical body. And this is the most initial thing, where they are not sure what's happening. They don't know if they're dead, if they're dying. They don't have the words, and it's very difficult to describe. And there isn't language really available. Many of them meet spiritual beings. Some of them will talk about this beautiful light that they stepped into, and for them, it feels like God. It is brilliant, but not noxious. And many people, and children alike, will say, I died, I went to heaven, I talked to God. They have a great deal of knowledge of nature. And this kind of depicts what people feel like when they're moving out of their physical body. And a lot of people in accidents will talk about what's happening during a resuscitation. They're up on the ceiling watching this. They can hear and see everything that's happening, and they can repeat this later, which they may have been unconscious or in a coma at the time. And this is, of course, very interesting for the physicians. Many talk about being greeted by a religious figure. They have a panoramic view from others, and it's called a life review. And this is a room full of pictures of different aspects of their life. And many times they're seen from the other person's perspective. For example, if they're bullying somebody, they're going to feel it from the person they're bullying's perspective. It gives people a real come to the world review, because it's frightening sometimes because they were so nasty and now they're feeling that nastiness. Sensing a border or limit where you can't you can't go beyond it. A lake, a row of trees, they know if they go beyond it, they won't be able to get back. Sensation of flying through a tunnel. And for children, it's a little different, but for adults, they see dark or squares or something and a light at the end of the tunnel. And being able to run through this tunnel. A place where all knowledge exists. At the moment they're there, they know everything there is to know, and they can ask any question they want and be given the information. They can't come back with all that information, but they do come back with some of it, and I'll give you an example about that. Of course, there are common events witnessed while they're out of their body. They're looking, and down in the waiting room is their family. They can hear the conversation the family's having. They can move around and go anywhere. And of course, that's very interesting, and sometimes very interesting events happen during that time. This is kind of a border picture where they know if they go beyond that, they won't come back. People will try to say, I don't want to come back. And if it's not their time, they're just going to all of a sudden end up back in their physical body. This is a picture of the tunnel and what it looks like to many people. And the light and a sense of love is associated with this light. People will talk about feeling like the most loving, unconditional love they've ever felt in this world. And it's very difficult to move away from it. Many people say, I just want to stay here. I don't want to leave. Other characteristics, kids will tell you, adults will tell you about the city of lights. And it's brilliant, different lights where they go to. Many times in this place, sometimes people will say, I died and I went to heaven. Wherever this place is, they are frequently greeted by deceased relatives, and frequently relatives that they didn't know. Children frequently talk about great-great-grandparents, how they died, where they lived, and the parents usually don't know anything about it. And then when they research it, it is in fact true. This for me was the aspect early on that really convinced me about this, because there is no place in the world children can get this information from. And they will try to share it with their parents, and if their parents tell them, I don't believe you, or you don't make things up, that is the end of, you're not going to hear anything. Heightened sense of perception, they have excellent perception, a sense of all knowing and knowledge of the future. Many of them have prophetic visions about different things, accidents, earthquakes, those kinds of things. Messages regarding their life's purpose. Many times they are given an idea of what it is they're supposed to do. Anita Moorjani's a good example. She was dying of cancer, had tumors all over her body. She's written the book, Dying to Be Me. And as she died, she had a near-death experience. And she was told, you're going to be all right. You're going to wake up. There won't be any tumors. And I want you to go out and talk about forgiveness and leading a full life, etc., which she has done and does that all over the world now. And she woke up, never had any medicine again, didn't have any tumors. And it's a really evidential look at somebody who has body was full of tumors 1 minute and none the next. She's an incredible speaker. If you ever get an opportunity, listen. People talk about a sense of oneness and interconnectedness, like people are connected to the trees, to the animals, to nature, and to each other. And of course, if we felt this, and if people paid attention to this, there'd be a lot less violence and problems in the world. Some of the after effects for adults are light and sound sensibility. And these after effects are not trivial. They don't just go away the next day. They are there forever. And I've been at a luncheon outside where an ambulance came by, and all the near-death experiencers at the table all put up their hands to their ears because the noise bothered them. And that's why you have to look at, like, children. They're not going to want to play hockey. It's too noisy, it's too bright, it's too violent, and they're just not going to do it. These people become more altruistic. Many of them change professions. I know several stockbrokers, Wall Street people who, after their NDE, just wanted to write. They wanted to do something much more altruistic. And some of them are from famous families. If I mentioned the name, everybody would know who it is. And their families just thought they were crazy because now they're not interested in money. And of course, this really affects people's relationship. Not a lot of wives want to forget about the house, in Caribbean of some type, or the boats and the planes and the extra money. They're not willing to give that up. And so about 50% of NDEers end up in divorce. They are very intuitive, much more creative, friendly, caring, forgiving. And that's one of the reasons why religion doesn't play a big part in this, because when they have this experience and they go to the other side and see life should be, and you should be more forgiving, more caring, that's it, more loving. There aren't a lot of laws, there aren't a lot of things that are rules. And I've had Catholic priests who are experiencers say, well, what do I do now? How am I can't teach the Catholic rules and regulations because it wasn't real for me when I had my experience. So it does become a problem for some people. Interested in subjects not previously known. I know a guy who was a jock in high school. He was training for the Olympics almost his whole life to be a bicycle rider. And he was under a car fixing it, and the car fell on him. And during this time, he had a near-death experience. And he told me, he said, I had never read a book in my life. And after his experience, he kept seeing these equations, the name Max Planck. He kept seeing all these different things that had to do with quantum physics. And so eventually he went to the library and asked for a book on physics and found all these equations, the father of quantum physics, all the things he'd been seeing were right there. And he just hadn't known anything about them previously. Some of the after effects that would be very difficult for military members, there are some. The loss of fear of death is something all experiencers pretty much feel. They don't want to feel a horrible death, but they're not afraid of dying. They've been there once, they've seen it, they know what it's about, so they are very happy to be back in that place. And many times that's a problem when they felt such love and connectedness, and then they're back in their physical body. There's no pain when you're outside of your physical body. There is pain once you go back into it. And then especially to not have somebody listen to you, there to support you. It isn't difficult. It is fairly simple. People are more spiritual, not necessarily religious. And of course, that is an issue for some folks. Maybe much less religious. They have a disregard for time. This, of course, would be difficult in the military. They kind of get into their head a lot, and they're just kind of loosey-goosey when it comes to time sometimes. And you can imagine that that's not going to go well in the military. More generous. I know a young man who was coming home, had his check for the week, saw a mother and a child in the street who had nothing, and he signed over his check. Of course, that's wonderful for him, but not too great for his family. They weren't too excited about it. The expansive concepts of love, they have a different feeling about love, and this is really difficult for wives or husbands. When somebody has a near-death experience and then they come back from that and have felt this unconditional love, and they have love for everybody. And so now they're wondering, okay, what is going on here? What's going on with my husband? I sent this person to war, and this is not the same person I got back, and that is an issue for them. Because of that, it's challenging to maintain relationships. And this would be a problem in the military as well. The whole concept of chain of command and all of that, it would be questioned, especially the violence. They are convinced of life's purpose. Many of them will come out of this experience and they know they're going to start a foundation for something. I know one that he and his buddy were both blown up in the same Humvee. They came back and started a foundation for housing for veterans. And it took a lot of energy and a lot of time, and consequently, I am sure the wives felt neglected in some ways because they can't possibly understand the strength of these commitments to purpose. It's very, very difficult. They have a heightened sense of touch, taste, smell, and texture. And many times they mix these up. Some people, I know she tells me that she can see colors in music, or they have a touch, a sensation when it comes to something else, the air or color. And so it gets very confusing and difficult for people to explain. Many experiencers have increased psychic ability, and this adds another layer of difficulty for people who are trying to understand it. They can see spirits, they can see objects that happened in the future. They can communicate with spirits. It's difficult. And I know a social worker who had an NDE, and she was just, I don't want to know anything about it. I'm too frightened of it. I have to deal with my NDE, but I don't want to know anything about psychic ability. And so she just sort of shut down on that. Increased interest in learning. They're interested in quantum physics and spiritual things and a lot of consciousness. There's a great deal of consciousness research going on now, but they may not have been interested previously, but certainly are interested now about some of those things. They have a change in thought processing, and this processing change could be a problem in the military. They also don't like violence, so this is going to not work well in the military. Their altruism also is a problem. When I was stationed in Germany, I had a commander of a dental unit call me. He had seen my picture in some magazine or something, and called and told me about his near-death experience. He was a commander and was a West Point graduate. And after his experience, he said, I don't know what to do. When it comes to disciplining these young soldiers, he said, I just want to put my arm around them and say, it's okay, we'll work it out. And I said, well, you know, that's not going to work well in the military. And you may just not be able to stay in the military because of all the conflicts you have now with your new moral and values and things that are just different. And these things last a lifetime. Certainly greater curiosity and very interesting people. Body clocks are different. Some people who are morning people then become night people, etc. also doesn't work well in the military. Less tolerance to chemicals, even things such as washing material for dishwashing, washing your clothes. The chemicals in that are difficult for people. Any kind of, you know, like bug spray or different kinds of spray is a problem. We talked about the multi-sensing. The electrical sensitivity, many near-death experiencers can't wear watches because we all have an electrical body that surrounds us. And something happens when the near-death happens, the near-death experience, that interferes with this sensitivity. And they'll put a new battery in it, they'll set it down, they'll wear it. 2 days later, the battery dies. They'll do it again and again. So they can't wear a watch unless it's solar power or not run by electricity. They also, you'll hear about people going in and their computers just go haywire, or they walk along and you will have lights that flicker. And one woman I know, PMH Atwater, who has written several books. If you want to learn a lot about NDEs, read her books. It is fascinating because she has early on used to blow out computers wherever she went. She has learned to really take care of those things now, but it's difficult. Many difficulties with families because they're not the same person. They're just different people with very different perspectives. Frequently have lower blood pressure, less tolerance for medication. Many of these people can only take a tiny bit of medication, and for some people, medication doesn't work at all. So it is a real problem medically if people don't know about it. Little tolerance for violence. This is a huge problem in the military. They cannot go back out there and fight. They would not kill somebody, and it would just be a real issue if they were in the combat zone. They could be someplace else where they're not required to fight, but this is a real problem for people. These changes are significant and they are detailed and forever. And people remember their experiences in detail years later. I've had people that I know who told me about their experience 15 years ago, and they'll come back and tell me about it again and talk to me about trying to integrate their after effects and how life has changed. They're much less materialistic, not terribly interested in money. And some have great healing ability. And that is kind of scary as psychic ability. But many experiencers do have healing ability. And difficulty with boundaries, always a problem in any aspect. Some of the issues in things are about security clearances. and may not remember the experience, but have after effects. The military tries to lump it with PTSD, and that is a problem. If it's not addressed correctly, they may have great difficulty after the fact because it isn't going to work to throw them in a PTSD group. It isn't going to work to medicate them, which happens frequently. And they have to be able to know and talk about their experience. Many times they see their buddies who were injured or killed, and they are able to see their experience, their spirits. They know who's going to live or die. That in itself is frightening because they feel like they might have had some influence in that. They are afraid that no one will believe them, and no one frequently wants to even hear them. Commanders, you're certainly not going to tell your commander. I know people who have tried to go see their clergy. They've tried to talk to their doctor, and nobody wants to talk about it. Nurses frequently know what it is, but they may not know exactly what to do. It's a very, very emotional and personal experience. They believe it may affect their benefits, even though that doesn't sound realistic. For them, it's a big issue. And if someone doesn't believe them, it affects them in many, many different ways. If they want to stay on active duty, they could believe it would affect their security clearance. And if they told somebody, it probably would. Concern about NDEers getting in military records. They don't want any of this in their record because it might appear that they're crazy. And I can see how that would happen because young people who have these experiences can say, I died, I went to heaven, I saw God, I communicated with God, I saw my deceased relatives. Well, a psychiatrist is probably going to tell them they're having a psychotic breakdown. And very unfortunately, we see this a lot, and they put them on bipolar drugs or other kind of medication that totally messes them up. And what they needed really was just for somebody to listen and say, I get it, you're okay, you're going to be okay, here's some information. That's the most important thing that you can give to people. Family issues become a big deal, and the wife wants the same husband back she had before, and she's not going to get that same person back. He may have very different priorities now. He will not be able to deal with combat because of the violence. And certainly commanders are not going to understand this. So there are some guidelines for support. The biggest thing is to listen. Let them own their own experience. They don't want an interpretation. They don't want you to try and make up a story about what it is. Just listen what they have to say. Don't judge the experience. Even if you don't believe it, let them tell you their experience without judgment, without anything. Try to keep eye contact with them. You will see people who have had an arrest or had something, and they have a look about them like they've got a secret, but they're afraid to tell you. They might want the lights kept on. And they might try to tell you, but you're going to have to sit down and look at them and listen. It's great if you can provide resources. I used to encourage people to get a few articles, a website, and give them a packet of information so that when they go home, they can continue to learn. Now there are thousands of books and movies, and many by physicians. Bruce Grayson, the father of research, just came out with an excellent, excellent book that's very grounded for the average people. Eben Alexander wrote Proof of Heaven. He's a neurosurgeon who didn't believe in these experiences and then went into a coma and had an experience, and it was very, very important for him. They just want to tell their story. Don't try to analyze it. Refer them to IANS. That is the greatest thing you can do. Patients talk about strange dreams, clues to listen for. They're not really talking about dreams, but it's a safe word. They have some kind of faraway look in their eyes. They may want the lights left on. They may lose the fear of dying. They may seem to come and go out of this world. This happens also with patients who are dying. They will be in a coma. They'll sit up. They'll say, "Bud, I see you." And they're talking to somebody up in a corner who has come to get them. And many times they will just lie down, and the next thing you know, they've died. They frequently are afraid to talk about it. They need help talking to families, somebody to help them understand the experience. You can't assume all clergy or doctors will know about these experiences. They don't. You may need to provide materials or find somebody that does know about these experiences. Let patients enjoy the experience and have fun with it, and just let them know they're okay. You're okay, this is normal. And we need to encourage them to write it down and gather the details. It's very interesting the amount of details they remember 20 years later. I have talked to people. Here's some resources you can use. I have a lot of information on my webpage. It's very interesting to talk to people. I met somebody at my Vietnam Memorial reunion, and I was talking to a patient who actually was brought into the hospital where I was, and he tried to tell me about this experience he had. And he said the doctors at Walter Reed, he was a head injury, just got up and walked away and said, "Don't tell me about that. I don't want to know." So it's really terrible. And there's a lot of Vietnam veterans and other veterans out there right now who don't have anyone to talk to. I recently wrote an article, and I think you have, it's out there for you to read, about the unethicalness of not paying attention and just listening, or finding someone who can listen to these folks. It is really terrible for them to not be able to talk to somebody. I'm happy to answer any questions, and I'm happy also to stay here for as long as I need to do that.
Hi, Diane. It's Lenny again, and hello, everybody. First off, I'd like to apologize to our attendees because apparently many of you, or perhaps all of you, are not able to see the participant list. So we're not quite sure why that is. I can see it. And I'll just tell you that there were 77 of us on this presentation. And we have about 11 questions right now that I'll start with. And as Diane said, she is willing to stay around if we don't get to your question right now. So I think you may have answered this one, Diane, but it says, is there any relationship with NDEs and end-of-life experiences?
Well, there is an experience called NDAs, and it's called nearing death experience. And it's similar but different. A lot of patients have near-death experiences. They kind of come and go in terminal illness. They will have these experiences during bouts of time. So yes, many people have it. You just have to be able to sort whether it's a nearing death awareness or an NDE. And you go back to the characteristics that I talked about, and that's where that comes from.
Okay, the next question is, what would you recommend as a research focused topic for a graduate thesis or doctoral dissertation?
Well, there are many of them out there that are working on that. I think the thing about medication would be interesting. Attitudes of nurses would be interested, and the care that they give associated with that. So I think there are several things. I'd like to see a long-term research program on children, because these children are exceptional children and they're very different. So if you could identify children, I have a nephew who's an NDE-er. I identified it at about 18 months. If you could identify them and then follow them for several years, that would, the kind of professions they went into, the difficulties they had or didn't have. They're very, very smart children. And so they are a challenge for families. So I think there are a lot of things you could look at there.
Thank you. The next question is there an associated suicide rate correlation with those that experience NDE?
This is something I should have said before because it is a big issue for me. I believe that those people who have NDEs, along with post-traumatic stress and physical ailments from some kind of combat situation, and don't ever get any kind of support or acknowledgement, are higher risk for suicide. I think it contributes to our suicide rate. And in fact, I know it does based on some experiencers that I've talked to. And we have had some research in DOD, one study by a Dr. David Hufford and Bruce Grayson, and found that 50%, 48% actually, of combat veterans have NDEs. So that's a huge number of people that have, for the most part, never been given any support or any acknowledgement, and that's all they need is support and acknowledgement and validation.
Okay, our next question is, do people re-experience their NDE in terms of reliving it or dreaming about the experience?
Yes, many people do, and many people also have multiple NDEs. I should have said that. We have people who have had 2 or 3 of them within the same illness. There are also distressing NDEs, and they are more lonely. We don't hear about them very often, but they are NDEs where the people feel more isolated. So a lot of things can feel differently, and I absolutely believe that the suicide rate is connected to people who have unresolved NDEs.
Okay, thank you. The next question, do any experience hell versus a heaven-like experience?
That's what we call the distressing NDE, as I just said. And there is one book out, and it's called Dancing in the Dark, I think. We don't hear this hellfire damnation situation. As long as I've been doing that, I have never heard of one. I have heard of a person who had a more isolated NDE and they felt lonely, but they integrated it in a very positive way and have been associated with the near-death community for a long time.
Okay, and I think you may have touched on this. The next question is Is there a length of time associated with NDE? Did the individual convey a reference to how long ago they experienced the NDE?
Well, many of them, we have people who talk about NDEs they had in utero. And by the time they got off um, um, uh, old enough to talk, they told us their experience. So it can go from any age and back and forth, and they can tell you years on about their experience and in the same detail and understanding as when they first talked about it.
Okay, the next question. Is there research on veterans and near-death experiences?
Just the one study by David Hufford and Bruce Grayson. I would love to see some research on veterans, because we know there are many of them out there based on their study. And an interesting thing in their study, they also talked to doctors, and they said, do you think that these patients should have the ability for you to talk to them? And every doctor said yes. And then when asked, what would you do? What did you actually do if you found a patient like this? And they said, give them medication or refer them to psych. So they don't actually do what they say they know they should do. They do something to not have to deal with it. And I know a nurse that was put in a psychiatric ward. I know children who have been given medication. I know a young man who was put on bipolar medication, totally messed him up. And we eventually got him off that and back to that. So a lot of terrible stuff happens.
So this is an interesting question. Do near-death experiences mean that there is life after death?
Well, certainly one would say that's true, because they used to think that this was a dying part of the brain. But we have experiencers now. Mary Neal, who's an orthopedic surgeon, was under a waterfall for 40 minutes. And when the pressure broke all her legs, and she eventually floated down the river, and her friends got a hold of her. She was obviously dead when they got her, and she was resuscitated. And she talks about her experience of being in the light and wanting to stay there, and seeing her friends try to resuscitate her and how badly she felt. So yes, there are a lot of people then, and certainly children, talk about it. And there's many, many spiritual things that happen. Unfortunately, we don't have the time to talk about it today. But there's also a great deal of consciousness research now, because they realize that we have many people who have died and their brain is not working when they had these experiences. So yes.
Okay, we have several more questions, but before I go on to those, Nikki McCaslin, Colonel McCaslin, who's our host, is going to put up another poll for you to answer. Well, he's going to show the results of the poll that we did. So I don't know if Diane wants to comment on the poll results, if that's what she usually sees, or.
Yeah, well, usually I can tell you that 10% of a normal population of people usually have had a near-death experience. So this is 9% of the people that we have gathered here today. So that's about normal. So they have had more people tell them about it. I think what you'll have to do is listen very carefully, because a lot of people don't talk about it. I've given lectures where a mother and daughter both ended up at the lecture, both experiencers, and had never told each other. So it's a very, very personal experience that's hard to talk about.
Well, thank you. So I think that might go into a couple of other questions. We have a few that are sort of related. Is there any solution for the patient with NDEs except to listen to them? They seem to be just lonely and unaccepted.
You need to listen. You need to provide them some resources. You need to tell them they're going to be okay. If you can hook them up, we have groups all over the country in IANS that they can go and be part of. Now we're doing Zoom groups, sharing groups. And so I actually have a Zoom group for military, people who are military and had an NDE. It's on Sundays, one Sunday a month, usually the middle Sunday at 4 o'clock, and it's free so that they can come and talk about it and share their experiences. So there are a lot of things IANS has online now to provide support.
And a similar question, just a little bit different. I was a critical care nurse for a long time. What are your thoughts regarding how nurses should help or advocate for patients when they are dying and the team is working to not let them pass? Does the patient have a choice?
Well, the team needs not to be working at not letting them pass. The team needs to be helping them pass comfortably. And that is something that can be helpful. I have given it, and it's very individual. People who have lost children or lost someone, I have given them NDE information so they know that where this child went is a loving and beautiful place. I think we need to help people pass over, many of them, and tell them not to be afraid. Somebody will be there to get you and come and be with you. It's going to be all right. You're going to be comfortable. You're not going to be sick anymore. You're not going to have all these difficulties. And so I, for the last, once I really got it, have spent my time helping people pass comfortably and knowing that they're going to be in a better place.
So
It is not something to tell people who have lost someone, oh, they're going to be in a better place. Nobody wants to hear that, but the patient themselves sometimes will want to talk about that because they're afraid.
we have somebody who wanted more contact info about those Zoom groups. So would they go to the website for the International Association
Yes.
of Death Studies?
Yeah, and it's called ISCO. Yeah, it's you'll see it on IAN's webpage. There are groups, webinars, all kinds of speakers, etc.
Okay. So the next question is, well, I just lost it. Where is it? Oh, it's further up. Hang on. So you mentioned electrical sensitivity. And the question is, are NDEers more sensitive to lightning and thunder?
That's an interesting question. I would think so because of the noise and the electrical charge. It's not something we've ever studied, but a very good question and something I will bring up to look into.
Okay. Are there any articles that speak of this nearing death experiences and end of life?
Nearing death awareness. Yes, Maggie Callanan has written a book called Final Gifts. And it is an excellent book about communicating with the dying. And it's a very small paperback, and describes the whole array of things that go on with nearing death awareness in terminal patients. She's a hospice nurse, or was a hospice nurse. And so I would say that would be the best reference, and you can look up, probably Google her, and I'm sure we have done lectures together where she does nearing death awareness and I do NDEs, because they're similar, but they're different.
Okay, the next question. There are people who say they can practice astral projection. Is this separate from NDE? Is there any evidence-based support for such a concept as astral projection?
Out-of-body experiences is one of the aspects or characteristics of near-death experiences. And there actually is a Dr. Parnay from Cornell did a study in about 41 hospitals trying to validate the idea of patients leaving their body. And he did this by putting computers up in the corner and rotating symbols, etc., assuming they would go up and look at these computers. I have always said, I think that's not well put together, because most people who come out of their body are going to go up, look around, see what's happening, and then go someplace else. They're not stopping to look at computers. So there is some evidence out there for veridical perception, and you can just Google that and look at that.
Okay, and then somebody wants you to repeat the title of the book just mentioned, but
Dying to Be Me by Anita Moorjani.
okay. And then there was somebody named Callahan, is that right?
Maggie Callanan, and it's Final Gifts.
Okay.
And she wrote another one, which is very interesting. She's an Irishman with a great sense of humor, and she wrote a book called Final Journeys. And it's all the decisions people have to make once they have a terminal illness. And so the one title I remember of a chapter is I Love You, Mama, but I'm not moving to Miami. And it's about things you have to do sometimes when parents or other people become terminally ill. Both of them excellent books.
And one of our participants must be like me, a Google queen. And she said there's a military medicine article from 2014 by Goza, Goza, that talks about combat near-death experiences and exploratory study. So if people are interested, they can look at that. It's in the Q&A. And let's see. Have service members ever received disabilities after leaving the military from VHA? I assume specifically for an NDE.
Oh, no. Yeah. And I mean, I have written letters for service members outlining their NDEs and the after effects, but we cannot get the VA to even treat some of our service members with severe physical problems. I'm helping shepherd somebody through that process now, and it is absolutely ridiculous what they're put through. And so, no, at this point, nobody's going to pay attention to NDEs. I think someday they will, but not now. I would like them just to pay attention and provide support and education.
And this is along those same lines. Diane, I disagree with you about near-death experiences. To me, near-death experiences are hallucinations. Can you explain the differences?
Well, hallucinations are usually something that comes, it presents itself, and doesn't last long. It's, it's not a very specific bunch of characteristics. There's an excellent article in, it might have been in JAMA by Dr. Bruce Grayson that explains the difference about why NDEs are not hallucinations, they are not a mental health problem, and this has clearly been demonstrated in his research and many others.
Okay, and I'll do the last question now for our 1 hour, and then if people want to stay on, there's only about 1 or 2 questions I haven't asked you. And the last one will be, do near-death experiences people who experienced an NDE ever continue to have contact with deceased relatives or others?
Well, many of them do continue to have contact with the spirit world and can communicate. And this is true of children. An example of that is after my father died, I said to my mother, I want you to know that it's possible Dad could come back and present to you, or you might just feel him, or you could see him or hear him. And she just said, I don't believe in any of that stuff, so don't talk to me about it. And she was a nurse also. My nephew, my 4-year-old nephew, was sitting behind her. I went downstairs. My nephew came and followed me right down the steps and said, Aunt Diane, Grandpa's here all the time. I said, he is? I said, do you see him? He said, absolutely. I said, what does he look like? He said, he has on that white sweater he used to wear and gray pants, but he's not so thick. Great description of a spirit. And I said, well, do you talk with him? He said, no, not really. He comes into my brain and then I can send thoughts to his brain. Telepathic communication, exactly what spirits do. Here's a 4-year-old that got it. He would have never, ever said anything if I hadn't asked my mother. But he sees my grandfather there. And kids see spirits. They interact with spirits. But they're frequently told not to, or, talked out of it by the time they're 9 or 10. I want to say one thing now. There is lots of research out there. There's lots of material on NDEs, and now pretty much everybody in the general public knows about it. It's been on every TV, not always represented well. But if you do a fairly significant amount of reading, there's many things there that will help you understand near-death experience, spiritual transformative experiences, and how they differ from any other kind of mental health or hallucination.
Thank you for that. Well, we have some comments about what a great job you did. And I know that ANCA really appreciates you giving us our time. And we hope this was helpful for all of you. As Nikki said, you'll get a survey as you log off. We're open to continuing to do this and would love your input on topics for future ones. Here's another one that thought it was outstanding. So thanks so much. And if you care to share more about that experience with the soldier in 1969, I think that's the only question that didn't get answered. Here's one that says you're fabulous.
Thanks. I wish I'd had more time. This is about an 8-hour lecture. We do also have a movie now that was made of veterans who had near-death experiences and how they were treated. There is a Netflix presentation called Surviving Death that would be good for you to look at. And there's many movies now. I'm trying to think of the one about the child. I just looked at it again. I've seen it several times. And Heaven is Real, I think the name of it. It's about a child. But the one in Vietnam is he basically said he lifted up from his experience and felt that he could see who was going to die and who was not going to die. He watched his body in the rice paddy and he said, I wasn't in pain. I was just moving around. I couldn't figure out what was happening to me. And he said, and then I went to outer space and I looked at all these beautiful colors. I was in some place that had beautiful music. It wasn't like any music I've ever heard here. And he was describing in great detail all these things. And he just kept saying it was so wonderful. And then he said, the minute they picked me up and were going to put me on an ambulance, I was sucked back into my body. And it was very painful and it was, horrible. And I'd often wished I'd kept his information so that I could go back, because I didn't know, it's 1969. I had no idea what he was talking about. Raymond Moody didn't write his book, Life After Life, until 1976. But I knew I had to say something positive, and for whatever reason, this young man changed me, because I went home and I started doing lectures and information and getting a hold of near-death experiencers, and really spoke a lot while I was on active duty about it. And I doubt that they're paying attention to it on active duty now, and it's a shame.
So we have enabled the raise hand function. If you would like to unmute yourself and speak with Diane, we can probably do that. Hopefully that'll work better than me telling you about the participant list. So if you raise your hand, hopefully I'll be able to see it and I can call on you so we don't all speak at once if there are any other questions. But you got many kudos in the Q&A. Diane, I hope you'll be able to
I'm so
read.
sorry I had to do it so quickly, but it's important that you just get the essence. Usually I give all day or half day lectures to really give a lot of examples and the research and, different books and things like that. But you got just the basics this time.
Well, I think you did a great job of keeping us on time and being able to answer everybody's questions. So if there are any other questions or anybody wants to raise their hand, let me know. Otherwise, we will end this. You can Google Diane. She has a consulting company, and I think you can contact her through that if you have more things you'd like to speak to her about. Oh, we got some hands up. So Karen Gaussman, can you go next?
Diane, I just wanted to check, given the lecture that you gave us today, do you still expect to be able to join us for the 2022 convention in Bethesda in October of next year?
Right, absolutely.
Okay, thank you. We appreciate that.
Okay, and the next person with their hand up, if you can unmute, Nikki, is Myrna Armstrong. And there you are, you're unmuted
Yeah,
now.
I just wanted to follow up on that electrical sensitivity. This was a comment from a good friend of mine who was a Vietnam nurse, and she has since died. But she called me one day and she said, would you please explore electricity and sensitivity, because every time it lightens and thunders and such, I have such sensitivity to everything. And now that I sit here and listen to your conversation, I'm wondering if maybe at some time she did have a near-death experience of some sort.
Well, it could be very possible. It's amazing the number of people that don't realize that they've had near-death experiences or some kind of spiritual transformative experience. The young man, he wasn't young, he was at the time, Vietnam, at the reunion, talked to me about, well, when I came in, he had a vascular injury in the back of his head. And he said, some sergeant had a hold of the artery in the back of my head. And he had a white uniform on and green rank in his name, and I don't remember what his name was. And he walked with me all the way to the OR. And I said, Michael, we didn't have anybody in Vietnam who wore white. He said, oh. And I said, I don't think it wasn't a corpsman. At least a corpsman that worked for us. It could have been you know, a spiritual experience of some kind. But then he said, oh, well, that's interesting because during this time, I had a friend of mine sitting on the end of the bed talking to me, and then I realized that he died 10 years ago. So they don't even try to put this stuff together sometimes until you help them look at the different aspects of it.
Thank you.
I think, Myra, I think it's really interesting, and I'm gonna pass this on to Bruce Grayson and see if he knows of any research. And if you'll email me to remind me, I'll get back with you.
Thank you. I will. Okay.
Oh, wait, Mary Larchie. I hope I said your name correctly. Mary, will unmute you. And you'll be able to ask your question in just a minute. Okay, you're unmuted.
Okay, thank you. When I was working in intensive care, I was taking care of a post-op heart transplant. And I was on the shift where we extubated her. The first words out of her mouth were, I was awake for the whole surgery and I was in tremendous pain. Now that I've heard this presentation, I'm wondering if that was a near-death experience, in that although she didn't talk about leaving her body or being up in the corner of the room, but she sure has the other stuff. She could tell you what surgeon said what during the case.
Yeah.
And we had anesthesia see her because we felt that maybe this was one of the residents. They gave paralyzing medicine, but they didn't give the unconscious medicine. But now that I've heard this presentation, it sure sounds like an NDE to me.
It certainly could. It's too bad you can't go back and ask her some questions. There is tend to be a inverse relationship, because a lot of people say, oh, it's just the drugs, especially anesthesia. But there's an inverse relationship to the use of drugs in NDEs. And anesthesia frequently thinks, oh, it's a brain thing. But we know now it's not a brain thing, because these happen outside a functioning brain. So really important for people to understand that. And there's so much research going on now. But if you do some reading of the different experiences, the link that I sent to Lenny that is from the Narratives of Ethics journal, The Voice, has some really wonderful narratives of patients in it as well. And on our website in IANS, we have about 1,000 experiences of people, if you want to just read some of those. But there's so much information out there now.
Could you tell me what IANS stands for?
The International Association for Near-Death Studies.
He wants to know, who can one talk to about their near-death experience?
Well, you can always call me, and you can write to me. There's a place on my website where you can write, and you have, I think, my phone number. Hopefully, there are people as I said before, in IANS, we have groups all over the country, and many of them now are doing Zoom meetings. And hopefully they'll start getting back together again. But I am happy to talk to anyone, because a lot of times people are just trying to sort out what kind of experience they had. Anybody who's still having difficulty about the experience has not had enough opportunity to talk to somebody and really understand it, and they're welcome to call me and talk to me. I think it's really important for all those people who are still working either on active duty or someplace else in a facility, to be on the lookout, because now that you kind of know the characteristics, they will key up to you, I think. And you can always ask people, did anything unusual happen to you during that arrest or during your surgery or during whatever? You don't want to put words in their mouth, but you also want to give them an opportunity to tell you about what happened to them. Could have people also, PMH Atwater has done a great deal of research on children, and children behave a little differently and have after effects that are quite interesting. And I would ask anybody who really thinks they have a child that is a little different or that, had a extreme medical crisis and then seemed to have a better vocabulary and seemed to be thinking in a different way, to please read some of PMH's books on children and NDEs, because that's very painful for children to spend their whole life being different without family support and assurance.
Any other questions? I don't see any hands up.
Look like one came into the
They want a
Q&A.
copy of your slides.
Nikki has a copy of them.
Yeah.
And just so anyone knows, I use the same slide presentation. Usually I do 2 or 3 hours, so I have a lot more slides on there. You can look at them and it'll give you some information about research and children and other things. I only gave a small portion of them today.
Okay. And if you are an ANCA member, they will be on our website. Yeah, I'm keeping an eye on the questions in case there's anything last minute.
Yeah, there is one question. I just looked at that. Is there a length of time? I think what somebody was asking is, how long did the people think the experience was? And a lot of times people will come back and they may have been dead for a minute and they'll say, I felt like this went on and on for hours. So there's not a relationship really between how they actually feel it's going and how long they actually were out. Mary Neal in her book and talks about it. I mean, she was clinically dead, and it went on for a while trying to resuscitate her. And probably under normal circumstances, had she not had this experience and told she was going to go back, and she had fractures all in her legs, in her chest. Her husband, she refused care because she was in remote Amazon. So this wouldn't work today, but her husband carried her on the plane and they had all kinds of problems until she got back to Montana, where she did have health care. But during the time she was in the light, she was told that her 18-year-old son, or her son, would not live to be older than 18. And that actually did happen. And so you can imagine people given information like that. And as I said, people who have been in the light grieve very differently, because they envision anybody who comes to the light is going to be loved and cared for and nurtured. And so it's not going to be an awful experience. As much as they would miss somebody, the fact that they know what the light feels like gives them a very different frame of reference for grieving.
And there's a question or a comment here. I think there's a relationship between sleep apnea and near death.
No. No, there's not a relationship between sleep apnea and near death. Near-death experiences come during a time of crisis. both medically or all the things that I put up there. Sleep apnea has different feelings and things that happen during it, but it has no relationship with near-death experiences.
Well, it was an honor to facilitate this for you, Diane. I learned so much. I was just spent all last night researching and learning more about the positives and the negatives and all of the literature that is out there. So I
There's
know
a lot of stuff now, and
appreciate
if people come and have questions, please share my information, my email or whatever with them. I'm happy to help anybody or any group.
Okay. We can do that. And your email is dcorcoran1946@gmail.com.
Right.
I got it by heart now. Anything else? We're going once, twice, 3 times. Okay, well, please do reach out to Diane. And again, it's dcorcoran1946@gmail. And thank you for giving me this opportunity to facilitate, and thanks for a very interesting presentation.
Yes, I appreciate it, and I'm happy to do it and happy to help anybody I can. In the nurse corps, even ICU groups or any particular group, I could do a short and sweet thing to give them the basics too.
Well, thank you.